Hey everyone, how you doing? Welcome back. So today let's talk about if you're going to get a full mouth of implants, if you're going to get all on four or any, really comprehensive dental treatment, is it going to change your speech? How is it going to change your speech? And what to expect in terms of speech? So if you've been following me, you probably know I do quite a lot of all on four treatment. So in a nutshell, yeah, all on four is going to change your speech, especially in the short term. Okay, and most people will get used to it. In fact, everyone eventually does get used to it. But let me explain the process, and if you're going down this route, let me explain what the issues are. You see, when we see somebody for a treatment like all on four, usually they've been affected by gum disease, and what that does is it actually loosens the teeth start tipping forward and you start getting gaps between your teeth. Now this over time will gradually change your speech, because noises like the TH noise, S noises, they're created by your tongue going up close to the back of your front teeth, and it's a way of controlling the airflow. Now if you've got gaps between your teeth, gaps which are developing, then you're going to suddenly let more airflow happen. Okay, but this is a slow process, so your body kind of gets used to small changes over time and it accommodates. Now when you decide to have something like all on four and we bring the teeth back and we close all the gaps, suddenly you're going back to where you possibly were a long time ago, but it's happening in a few hours. So you're not going to be able to adapt super quickly, but you should adapt pretty quickly. Now specifically with something like all on four, when you have the teeth done and you have your temporary teeth put in on the day, what I personally like to do is leave a gap between the fake gum of the all on four and the natural gum of the patient. And the reason for this is just for cleaning. Now for cleaning it's fantastic because you can get brush right in there, but for phonetics, when you're trying to talk, it's not such a good thing, because every time you talk you feel like bubbles at the top. And remember, this is really just for the temporaries, and in my experience a lot of people do just get used to this. For the finals I do make contact so the teeth and the gums do touch, but for the finals all the gums have healed, and we've had this period with the temporaries where our patients have learned how to keep everything clean. So it's a bit of an evolution on the process for them. They can still get brushes through, it's just a little bit tighter. The other thing that we need to be aware of is the length of the teeth. So if we make teeth too long, not only do they not look good, but it changes pronunciation. And this is something that some people may not get used to. So people have a kind of a length of teeth that they can kind of accommodate to, but if we make it too long, they'll start lisping or whistling, and that's something that some people might complain about, and that can be much more long term. The other thing is, especially with the temporary teeth you get on the day with an all on four, the teeth are actually quite thick, because the teeth are all made from plastic, and plastic, in order to get that to be of a sufficient strength, you need to have thickness of the material. With the finals, because the finals are made of different materials and quite often they've got a metal bar reinforcing them on the inside, they can be made much thinner, which again, the thickness is important because that can create a lisp as well. And almost everybody will comment on how much more natural the finals feel compared to the temporaries because of this whole thickness factor involved. So in short, yes, almost anyone will get used to almost anything. There are certain things which we need to be aware of, but if you're going down this route and you're thinking about having all on four and speech is important to you, just mentally be prepared that it's going to change no matter what you do. Even if you go for a denture or the clip-in teeth or all on fours, all of this stuff, the speech is related to the final position of the teeth, and if we're going to change the position of your teeth, expect there to be some adjustment. And what we recommend to our patients sometimes is actually, when they have all of this stuff done and the numbness and the swelling all calms down, read a newspaper in front of a mirror or something like that. Just read out loud, and that practice will help you become normal in terms of speech again. One of the treatments, and it's not implant related, but there is if we have braces fitted to the inside of the teeth, that dramatically affects speech. And when I used to do a lot of braces, what I used to find was after about a month, when the patients came in, I could understand them perfectly clearly, but they themselves would pick up on certain things that they were having trouble speaking with. So even with braces on the inside, All-on-4, or dramatic, what we call restorative treatments, there is always going to be a period where you have to relearn stuff. Okay, just be aware of it. Everybody goes through it, and everybody comes through on the other side. Okay, so I hope you found this video useful. If you've got any questions, comments, leave them below, and I do try and respond to as many as I can. All right, guys, I'll see you in the next video. Take care.